Here we present the case of a 14-year-old male with a lateral femoral condyle OCD lesion, hefty stage 5, and a large intra-articular loose body, treated with a removal of loose body and mosaicplasty, or transfer of osteochondral autologous plugs. Here we see a lateral femoral condyle with lucencies on the X-ray suggestive of a OCD lesion and a large osteochondral loose body on the sunrise view. MRI reveals the osteochondral loose body measuring over 16 millimeters and a corresponding defect on the lateral femoral condyle within the weight-bearing zone measuring 20 by 10 millimeters with associated 8 millimeters or so of involved subchondral bone, looking unhealthy, and loss of the normal condylar contour with defects and divots. The arthroscopy revealed a large loose body that upon removal was inspected and found to have sclerotic, rounded edges and no exposed bone, with an overall non-viable appearance and poor chance of ability to achieve fixation with healing. Arthroscopic evaluation of the involved lateral femoral condyle showed a large defect with clefts of unhealthy cartilage or fibrocartilage and a significant step-off in the native cartilage. Therefore, an open approach with a lateral parapatellar arthrotomy was pursued, demonstrating this area of involvement on the lateral femoral condyle in the weight-bearing zone. An osteochondral plug transfer procedure was performed with the first recipient site on the superomedial aspect of the involved area and a plug taken from the medial femoral condyle just anterior to the weight-bearing zone and just medial to the area of articulation of the patellofemoral joint in hyperflexion. A second recipient site was prepared and a second plug placed. The second plug was taken from the far superior aspect of the lateral trochlear ridge and placed in a snowman-type configuration. The 2-week postoperative X-ray suggested the plugs in place with no loosening or migration, and an 8-month postoperative MRI shows good incorporation of the deep cancellous bone and smooth reconstitution of the subchondral plate as seen on both coronal views and sagittal views in the weight-bearing zone of the lateral femoral condyle. The articular cartilage appears to have a smooth contour, and the normal convexity of the lateral femoral condyle has been restored. The T1 weighted images shows similar findings with good incorporation of the bone plugs, and the patient had done well clinically, having been cleared at the 4.5 month mark with no complaints of pain, swelling, or mechanical symptoms. He will continue to be followed for the long term to ensure he does not develop signs of arthritis or other symptoms. Thank you.